Good afternoon. I'm Dr. Aajay Shah. We are bringing you this another Facebook Live. This is my afternoon live. I do this about 10 or 15 minute long, different topics. We have done topics on nutrition. We have done topics on medical facts. So this is my daily commitment. I finish my healthy lunch in 5, 10, 15 minutes and then save 20, 30 minutes to prepare this daily afternoon live. To give you some update on our page, we have now 40,000 followers. 40,000 followers. That's in 6 months. So that is, in my opinion, is a great accomplishment. Thanks to all of you, all our followers who've been supporting us, who've been inviting their friends and family to like our page. So please, I request you that at least invite 25 friends today from your Facebook group. You can go to like pages and then select the friends you want to invite. And invite 25 friends every week and make this movement bigger. We post every day about healthy living. A lot of our people and patients have benefited from our posts. Many of patients are actually be able to go down on their insulin requirements, go down on their weight. So there are a lot of benefits of joining our movement. So please invite at least 25 friends today to like our page. Today's topic is actually a timely topic. Today I was seeing a patient who I asked about going. He actually said that if I go plant-based, how would I get my protein? So I thought I should do a protein itself, how much protein we need. And there was another question on nutrition segment also, that how much protein we need. So let's talk about protein. Number one, right off the bat, let me tell you, as American, we eat a lot more protein than what is safe. Not just more than what is recommended, but more than what is safe. We need about 0.35 to 0.5 gram per pound of protein. So that means about a 150-pound person needs about 45 to 65 gram of protein. 45 to 65. If your personal trainer, or if you ask any American, that would say you need to eat at least 150 gram of protein every day. And that to me is not only very dangerous, but is very misguided. The science clearly says that we should be eating recommended amount of protein if you want to live long, if you want to prevent many issues including and type 2 diabetes. So let's talk about what kind of protein source we should have. The best source for protein is a plant-based protein. What is the reason for that? Let me explain you what the animal source of protein brings with it. Animal source of protein brings with it saturated fat. Most meat, including fish, has a high amount of saturated fat, and that actually can cause a lot of heart disease, a lot of stroke. Number two, animal-based protein brings choline, which now has been implicated to cause to make the TMA, and that TMA converts into TMAO in the liver, and that has been implicated into a lot of heart disease and a lot of cancer. So again, second is the choline. The third thing is cholesterol itself. All animal products, all animal protein source contain cholesterol, and when we eat cholesterol, definitely it has shown to cause more heart disease, heart blockage, and stroke. So protein actually brings a lot of the other macronutrients and cholesterol, which causes a lot of disease, including heart disease. Animal source of protein also has been shown to cause rising of level of IGF-1, insulin-like growth factor 1, and that actually also has shown to cause cancer. So again, animal source protein definitely has been implicated into many cancers. Plant-based, plant source protein, even if you have a slight excess amount, has not shown to cause any cancer risk. So I definitely advise plant-based protein. But again, we don't need even too much plant-based protein. We don't need those protein powders. We don't need whey powders. Whey powder is essentially a processed milk-based powder, which has shown to cause increase in IGF-1. Even plant-based protein powders are not necessary. Plant-based protein powders have many ingredients which are chemically not right for you. So if you want to have a protein, have a whole food plant-based protein. And you can get actually plant-based protein from many sources, including beans, lentils, even nuts are high source of protein. You should be eating nuts only if body mass index is below 25. I've been recommending that you should not be eating nuts if you want to lose weight. You should just get your flax seeds to get your omega-3. So definitely plant-based protein can be easily achieved for what the daily requirement is. If you look at the long living population, for example, Okinawan people eat about 1700 calories per day. So they definitely do the caloric restriction, which has shown to cause the long lifespan. And out of 1700 calories for Okinawan people, only 9% calorie come from protein. Only 9% calorie come from protein. So they actually eat about 40 to 50 gram of protein per day. And they live up to 100, they live happy, they live healthy. So again, truly, we don't need the protein that much in our diet. Protein has been an American hype. There's a lot of money to make in protein powders, a lot of money to make in animal-based protein, a lot of money to make in animal-based products. And that's the reason we've been missing American to eat a lot more protein than what's required. If you're a personal trainer, or I call it a bro science, brother science, bro science, if they tell you to eat too much protein, tell them no, they're absolutely wrong. They're absolutely wrong. Trust me, the science on my side, science clearly says you should not be eating more than what is recommended amount of protein. Actually, there's even data that people who eat a lot of protein live less than people who eat recommended amount of protein. Protein also, particularly branched chain amino acids, which are the four essential amino acids, they also actually has shown to cause activation of mTOR pathway, and that mTOR pathway also has been implicated into many cancer risks and also living less. So again, protein, particularly branched chain amino acids, cause the mTOR activation, which is not healthy for you. So I've seen many bodybuilders, many personal trainers, many athletes recommending to take branched chain amino acid protein powder separately, like 5 gram per day. That's not required, in my opinion. That's actually detrimental to your health. So definitely don't eat or don't take more protein than what is recommended. If you take 5 gram less protein, you will be fine. You actually will live long. That's my humble opinion. I've never seen a protein deficiency. 40 years of my medical practice in America, I've never seen a case of protein deficiency across the whole country. I've never seen any journal reporting a protein deficiency in America. I've seen a lot of reports showing protein excess, but I've never seen a patient with a protein deficiency or a description of a patient who has protein deficiency. So never listen to anybody who says that you can go protein deficient if you eat plant-based food. Again, when I tell people that I'm vegan, most of my patients, most of my American friends, first question they ask me is, how do you get your protein? Obviously, they are not properly informed. They definitely are worried about protein more than they should be. So again, my final recommendation is eat recommended amount of protein, which is about 0.35 gram to 0.5 gram per pound. So that means a 150 pound person will need about 35-40 gram to about 60 gram of protein. Definitely eat plant-based protein, definitely no protein powders, definitely no protein supplements, definitely avoid animal-based protein as much as possible. So again, this was actually, there is another thing I should also like to mention. When you eat animal-based protein, your body creates an acidic environment, and that actually leaches the bone out of calcium. So when people eat a lot of animal-based protein, particularly dairy and many other meat products, their bone gets actually osteoporosis. So definitely animal-based protein should be avoided as much as possible. Actually, there's also some data that people who take branched chain amino acid can develop insulin resistance. Protein actually also can stimulate insulin secretion. Protein actually also can stimulate insulin secretion. So protein again can be as bad as sugar or can be as bad as simple carb. And all the excess protein we take does not get stored as a protein. All excess protein we take actually gets converted into and eventually into fat. So protein, when you take extra amount, don't think that your muscle or any other part of the body will store it. It essentially gets converted into glucose and eventually get converted into the fat. So again, excess protein is just bad for you. Avoid excess protein. Live like Okinawan people who live up to 100, and their protein intake is, to be honest with you, is no more than 40 or 50 grams per day. So if you want to live long, if you want to live healthy, please eat recommended amount of protein. Thank you.